Okay, so you're at the pool and there's a baby struggling in the water. You pull that baby out. They're still moving air and they're still conscious. No CPR at that point because they are still moving air. No back blows, no chest thrust. Get away from the edge of the pool, obviously. All we're going to do is help that baby to clear its airway by allowing it to cough and vomit, and it is going to be violent. If they are partially blue and moving air, it's really violent. When I've seen this in real life, they're going to be vomiting that water up with food at the same time, trying to take deep breaths, probably not that deep, to continue breathing, and they're going to then aspirate or breathe that vomit and that bile into their lungs, and it's a really violent, traumatic thing to watch. But keep that baby seated forward or nice recovery position to the side. While the baby is conscious that you just pulled from the water, they've ingested, they've swallowed a ton of water, keep them in the recovery position. Do not do this, because now gravity is just going to help that water and that vomit to choke this baby out. So keep them in the recovery position like this. Keep them in the recovery position like this. If unfortunately they do pass out, we're going to lay them down and start compression. Water, the baby is blue and not breathing. Tell somebody to call 911 and to go get a first aid kit and an AED. Next thing we're going to do is first we're going to give 2 breaths, mouth to mouth. And then we're going to jump into 30 compressions. 1, 2, 3, 4, 5, 6, 7. We always start with 2 breaths instead of compressions when somebody's drowning. So 2 breaths, 30 compressions, 28, 29, 30. 1, 2, 3, 4, 5. Keep compressing until 911 gets to you or the baby starts to breathe. 28, 29, 30 compressions, 2 breaths. We'll say the baby starts to cry. We're going to put the baby in recovery position. Positive control. Stay away from the edge of the pool. Let them vomit. They are going to be coughing up and vomiting out a lot of water and food. Or we can put them in a recovery position like this. Keep them angled forward so all that vomit, that food, and that water comes out of their stomach. Do not do this, because now gravity is just going to assist in choking that baby as they're continuing our compressions. 28, 29, 30. 2 breaths. Now the AED shows up and my first aid kit. So now I have my mask and my AED. We're going to go ahead and open that AED, have your partner start to continue using those 30 compressions in 2 breaths. First thing we're going to do is turn it on.
The child. Press the child button.
Because it's an infant and a child under 8 years of age, under 55 pounds, we're going to hit the child button. We're going to look at our pads and look for placement. Because it's an infant, he's under 8 pounds and under 55 pounds, under 8 years of age. We're going to put 1 pad directly in the center of the chest. Press nice and firm. Second pad is going to go onto the back of the chest, the back, nice and firm. Now, if the baby is in a puddle of water, we're going to want to move that baby out of the water. If the baby's wet, we're going to want to dry that baby off. We're going to go ahead and listen to the AED tell us not to touch the patient. So I'm not touching the patient. You're not touching the patient. Everybody's clear. Shock advised. I'm clear. You're clear. Everybody's clear. Baby's not in standing water. Baby's been dried off. It's telling us a shock. Make sure the AED is on the same side as you if you're pushing the shock button. Press the shock button. The baby will jolt. After we do that, press that AED, we're going to jump right back into CPR, and you are going to be doing compressions on top of the pad. 30 compressions. Just listen to the metronome.
20.
Listen to that metronome guide you through the CPR. Now your first aid kit showed up, so you have your mask. 2 breaths. And we're just going to continue to work 30 compressions and 2 breaths until EMS gets to us or until the baby starts to breathe again. If the baby does begin to breathe, we're going to go ahead and put that baby into recovery position, sit that baby forward, leave the AED pads on the baby, okay? If the baby goes back into cardiac arrest, the AED is going to tell you, hey, analyzing rhythm, don't touch patient. That way we can jump right back into CPR and let that device do its job. You can also do recovery position by sweeping under here, holding that baby forward. Now, unfortunately, if we need to keep working CPR once EMS gets here, then we're going to just go ahead and work that. But that's your application